there will be more information on how to get in touch with us later on. First of all, I would like to maybe spend a little bit more time explaining what is environmental health before we go into the career in environmental health and before we move on to looking at the degree here at Ulster. There are some misconceptions about environmental health. A lot of the time people think or associate it with food inspectors, or some people think it's akin to environmental science, but environmental health is a discipline of its own. And it is a broad, very broad discipline, but I think it's easily summarized by thinking about the environment in the general sense and how that environment can harm human beings. And the discipline of environmental health is to identify those dangers, those risks, to assess them, rank them, and to find ways of alleviate their impact on people's health. So it's a very proactive discipline. I would think it's what we do before people get sick. So it is about trying to get people to stay healthy for as long as possible. It is wide-ranging, so we're looking at the environment as globally as we can. So it could be the physical environment, but it could be the psychosocial environment, how we interact with each other, how we work together. So it is very, very broad, and it is about prevention. So environmental health also so then thinks about the environment as a broad definition as possible, but it is looking at the water we drink or that we need to thrive and survive, the food that we eat, the air that we breathe, the land that we use and we occupy, and the building in which we live in which we work. So all of these big environment probably make up our home environment, our work environment, and our recreational environment. And within those, there's a wide range of dangers, or we call them stressors. That's the word we use in our discipline, environmental health. And they can be biological, like bacteria and viruses. I think it's quite relevant at the moment with the COVID-19 crisis. It could be chemical stressors, like air pollution, for example. It could be physical stressors. For example, noise is a physical stressor. Social stressor, like stress that can occur in the workplace, and psychosocial stressors. So we are there to identify all of these stressors in the environments that I've mentioned before, and how we can try to assess those risks, to prevent those risks, and to put control measures in place to prevent ill harm occurring from the exposure to those stressors. So a career in environmental health is always one thing I mentioned during those talks, is that there's one thing that will be sure in your work life, is that no 2 days will ever be the same. So I think if you are planning for a career in environmental health, it will suit somebody that will be wanting to be very involved and problem solving, somebody that will probably expect the unexpected. So if you're looking for a desk type job, a 9 to 5, every day is the same job, environmental health is maybe not the right career for you. I think most of jobs are probably fairly 9 to 5, but there will be jobs in the industry that might require shift work. There might be a crisis that you might respond to on one day that will require you to respond to that and find solutions quite quickly. So things like a communicable disease, especially in relation to food poisoning outbreak that we need to respond to really quickly, or disaster management. So the environment health practitioner job has often been associated with working in local authorities or district council, but environment health practitioners can work in many different capacities for the public sector, the private sector, and many different wide-ranging jobs. So I'll mention those in a little while. Also, most people work in those following areas. food safety, public health, health and safety, environmental protection, housing, and in Northern Ireland, consumer protection. I think there are jobs associated with consumer protection in England, but they are slightly different than in Northern Ireland. But in Northern Ireland, a large proportion of our well, not a large, but a some will go into consumer protection. So I'll do a quick run through each of these areas. I'll not go into too much detail, of course, and I'm sure some of you will already have some knowledge of those. One of the big area is food safety and food standards, and you can do that working for the private sector, advising on managing food hygiene, food quality, food standard, and nutrition. Or you can work in the public sector, in local authorities, in enforcing enforcing food standards and food laws. So on ensuring that places deliver hygienic foods or safe food to eat. We also now have changed the focus from for safe food to nutritious food as well. So healthy eating is part of that too. Some pictures that probably summarize some of the work people will do in the food industry. So you can see healthy eating in the middle there. You have the horse meat scandal that was quite a big focus of some of the work that we did before. Looking at tainted food, and in here you can see a mouse that it's been in a loaf of bread. It's actually happened more than once, several occasions. So this is obviously a foreign object into food, so food hygiene issue. In here as well, in the upper photos, you can see mouse droppings on a kitchen counter during an inspection of a food business. So obviously not safe for a preparation area. And here you can see a little frog in the salad. So people have found really strange things in food. Often you can find things like nails, and pieces of jewelry even have contaminated some food sometimes. So those sort of things can happen. I think a frog is probably unlikely. The second element is pollution control or environmental protection, we call it, and that relates to a wide range of things. Again, a noise complaint, looking at illegal dumping, waste management, recycling, pollution, making sure that the soil quality and the land quality is good and appropriate for people to either live or work in the area, and air quality. So some example of that here, you can see some illegal dumping during the bonfire season, both because obviously illegal dumping and smoke and air pollution issues. Here we can see an air monitoring station, one of our students here taking air monitoring sample, and recycling is at the forefront of some of the work we do in environmental protection. One of the big areas, and Maura is working in that field at the moment, is health and safety. You can, again, like in the food theme, work for the private sector or the public sector. So it'll depend on whichever aspect you're in, either making sure that companies are all doing things legally, or if you're working for the company, to make sure that the company is adhering to the legal requirements. So, but things like trainings and preventing actions for companies, health promotion, carry out risk assessment, giving advice, and investigating actions. So wide-ranging field. Again, some pictures here of poor electrical safety, some training on how to lift properly. In here, we also can see that there's hoarding of boxes in the shop that actually block the fire exit. So it's a fire hazard in itself. And then also creates a problem of egress if there was an issue or a fire in the premises. And working at heights always is an issue, and you can see most people are, it's a bad example of working at heights. In housing and housing standards, really environmental health officers that are there to make sure that the place people live are safe, so that their sanitary conditions, dampness relates to that, the rights of private tenants, and home accident prevention for both the very young and people of vulnerabilities, either elderly or people with a reduced mobility, and houses free from pests. So again, some examples here. A few years ago, there was in the news a number of houses in Belfast, terraced houses in Belfast, had problems with rats. Probably actually ones that are close to businesses that deal with food, so rations or takeaways, attracting the pest. But yeah, this person ended up killing a whole bunch of rats and having buckets full of rats at the end of the night. So it's not very pleasant. So obviously that really has to be dealt with. We can see on these pictures rising damp. So normally there's also different type of damps, but this clearly is damp coming from the floor. The issue with dampness is mold growth, and those mold can be create allergens, and it's not a sanitary place for people to live. Also, an aspect of housing is hoarding that has to be dealt with. It's often complex issues that have to involve multi-agencies to resolve, often linked to mental health issues. So that's the psychosocial environment as well, which I mentioned at the start. Home sensory prevention. Sorry, I'm sniggering. I have a little 6-month-old at home, and she's just starting crawling. And yeah, the first thing she touched was the plug. So yeah, I should practice what I preach, really. Try to get everything safe at home. So all of these things come under the umbrella of housing. And then the final branch of environmental health is public health. With really looking at health promotions. Is there ways we can get people to be healthier, to get community healthier, to people take the right steps and the right choices? Under that umbrella comes consumer safety, which I think making sure that what people buy and purchase is safe for them to use, play, or even consume. Fuel and food poverty are things that we dealt with or dealt with in the local authorities. Tobacco control as well, and enforcing the non-smoking laws, and dog licensing and dog selling. All of that comes under the same umbrella. You can see here, I'm not going to talk through all the pictures, but here you can see 2 items that were purchased that were obviously not safe. This is where consumer safety comes. Both of them had high risk of fires and electrical fires, so that were quite dangerous. Things like electric blankets as well. A lot of our consumer protection people look at toys as well, making sure that those toys are safe for children to play with. A couple of years ago, I think it was wee pellet guns, and actually the pellet guns themselves were causing a lot more harm than they should have been. So that came under consumer protection, and the company had to withdraw all of those, the sale of those little pellet guns. And here is also trying to encourage takeaways to reduce the amount of salt or fats, so that consumers actually have a mindless choice. They don't have to choose a healthier alternative, but the food they purchase is already healthier. And this is a big part of health promotions, how we try to get people to take the right steps in the right directions. So the skills, I've always mentioned this slide for prospective students. I think if you are planning a career in environmental health, you need to be able to be flexible. You might come across something very different, something you haven't, or you might have planned your day. You come in at 9 and there's a phone call and you have to drop everything and respond to whatever the call was. So that is very important, that our students are flexible enough that they can change the way that they maybe seen that the rest of their week developing. Problem solving, I think, is an essential skill. You need to be one of those people that just want to go and get on with things, and that want to maybe think outside the box a little bit, understand people, why they took the action that they did, and how you can put strategies in place to help them cope and not have the problem either reoccurring or solving the problem itself. So the knowledge element is what we do at university. We can impart a lot of our knowledge, and the degree is there to give you a lot of knowledge on those 4-5 areas of environmental health, so you are equipped to deal with those problem solving. Communication is key. We need to be able to communicate to people adequately, so they understand why you are telling them to do things in a different way, in a way that they didn't do it in the first place, they don't want to do, or they don't know how to do. So it's really essential that we have the communication skills to get people on our side and on board, people willing to do or to make the decisions that are healthy or that are going to reduce the risks of them either having accidents or ill health in general. Working as part of a team is really important. A team of environmental health practitioner, absolutely, but also skills like working with other companies and other professionals. It is often the case that problems are more complicated than just one simple answer, and this is where the problem solving comes, but also being able to reach out to other professions to help you resolve the issue. Things like hoarding, you're probably going to have to get a variety of professionals to come together to help the person and solve the problem. And I always think actually all our students are like that. Most of our students are like that. I would say almost 95% are like that. Very, very positive people, and seeing the good in people, knowing that you can make a difference, that always really brings something to the job, and it will solve a lot of your problems already if you have a positive attitude towards them, and it'll help in your communication with others as well. So there are multiple opportunities of employment within environmental health because it's such a varied job. Most of our students find job in Northern Ireland. Some of them will find jobs in Ireland. Some of them will find jobs in the rest of the UK, and some of our students go abroad. Most of us students going abroad go to Australia. After their degree, we always have a few students that go and migrate to Australia. So people generally get a job where they want to get a job. So if you want to stay here and have a job here, you can find one here. But if you want to go somewhere else or further afield, you can too. A lot of our students would have traditionally gone into local authorities and district council. They are a big employer. But in recent years, I would say over the last 10 years, our students work increasingly for the private sector in great jobs, and there's also a great opportunities for career progressions in the private sector as well, from dealing with quality control, food control, to managerial positions as well. We have students working for big companies like Coca-Cola or Hilton, or Virgin. You'll see Virgin Travel and things like that. So you'll see later on, I think I have some examples. But yes, I had a student a few years back, and she works for the Hilton, and she has to fly all over the world inspecting their hotels abroad. I think that's a horrible job to have. I'm not envious at all. But we also have some of our students that work for government departments, like the departments focusing on pollution control sometimes, but also food standard agency, trading standards. And we have students that have gone into the armed force, so that we have, I think this year there's one of our graduates is going in the armed force as well. The salary is really hard to give you a notion of that, but the average salary is £22,000 after 6 months of completing the course, so it's a good starting salary. I think this goes, because it's such a wide-ranging profession and opportunities, obviously in local authorities, perhaps salary don't go as high as in the private sector after a number of years working, but it's a very different job, so it's hard to compare like for like. But yes, I think it depends, and for senior managerial role we get 60,000, but I would say maybe not everybody end up in managerial position, but I think it depends what you want to make out of your career, really. So I'll spend a bit of time talking about how we become an environmental health officer. So first of all, you have to have a degree in environmental health. You have to have an accredited degree in environmental health, and at Ulster we are fully accredited. We're the only course in Northern Ireland to be accredited. Our course is 4-year study with a 1-year placement, the 3rd year being placement. You can opt out of that if you don't want to do placement, but we recommend you do placement. I'm sure Maura can briefly speak to this as well. So our course is accredited by the Chartered Institute of Environmental Health, and if you are interested in a career in environmental health, you can go on their website and there's lots of really interesting information there. And we are also accredited by the Institution of Occupational Safety and Health, which is really important to private employers. To study with us, I have only on this slide A levels, but we recruit from, there are a bigger entry requirements. So you can go and get to those if you click on the link, or you can ask me at the end of the presentation. We need an A, a B, and a C, and an A has to be in a science, and we define science as mathematics, physics, chemistry, biology, geography, life and health science, home economics, food, nutrition and health, nutrition, food science, health and social care, and applied science. So yeah, that was a bit of math. So why should you choose to study environmental health at Ulster? We're unique to the Isle of Ireland. There's a course down in Dublin, but it doesn't have the accreditation, the full accreditation the way we have it. It's also the only course in the UK that still have an integrated placement here. The rest of the courses have dropped that. We think it really adds to our employability figures, meaning our students get better job more often than the rest of them. And feel free to compare our degree to the rest of the degree, and you can go to Discover Uni, the website. If you haven't heard from that before, that's a really great website to have a look at and compare different degrees. We have successful graduates. Most of our graduates, most of our students, when they come in first year, will stay on the course. Sometimes some courses people start and then they fizzle out and they really don't want to stay on the course, but we actually get the students in first year and get them through. Most of our students will either graduate with a first or a 2-1, so we get really good students at the start and we get really good graduates, and 100% of our graduates go on to either work or study. So that really shows that we can produce good quality graduates. So I'm going to finish there, and again, I repeat, if you have any questions, please, you can write them down and the moderator will feed them to me. But I'll pass you on to Maura, who's going to talk to you about our experience at Ulster.
As Marie was saying, I'm a 3rd-year placement student studying environmental health in Jordanstown with University of Ulster. I'm currently on my placement with McCluskey International, and I'm in a health and safety role. I'll start off with saying why I chose environmental health. To begin with, I was in, I think, either 5th year or lower 6th in school, and we got a talk similar to this in home economics or health and social care, I'm not even too sure. and it just sounded really diverse. It sounded really interesting. As Marie highlighted before, no 2 days are the same, and I can even vouch for that now, even in my role as health and safety. But I just like the different variety of jobs, the different sectors you could go into. Marie touched on them, the noise or environmental protection, health and safety, housing. I just liked having a variety. So I tend, not that I would get bored, but if I ever did, there's that many sectors and areas that you can go into and diverse and change upon, that I would never really be bored or be out of job. Also, the employment rates, as Marie had said, 100% of the students in environmental health end up in employment 6 months after graduating, which I thought was very good. That attracted me obviously to the course as well. So it wasn't going to be a waste of a degree. That it does make you very employable, and you can take it anywhere. Also, how I could take it, as I was saying, take it anywhere within the world. It's widely recognised. Environmental health is everywhere. So if I did want to travel, or if I did want to move, I could bring it with me. And even within the company that I'm in at the minute, they're based in Canada, our headquarters, and the opportunity to travel even within health and safety is widely known as well. Never mind all of the other sectors. That would be the main reason why I chose it, is because I wouldn't be bored. No 2 day is the same, as highlighted before, and I just knew I wanted a hands-on career that was will challenge me and sort of bring out the best in me. I couldn't personally sit at a computer desk all day every day, or even dealing with numbers or anything like that. Definitely wouldn't have been a career suited to me, but everybody's different. As Marie said, I definitely find that on my placement year, I've found out that health and safety, I do enjoy health and safety, and I probably will progress into a full-time job. I have been offered one with the placement company that I'm with. So it does make you very employable. You learn a lot of skills, even interpersonal skills that you're never going to learn out of any textbook or at any lecture, which is why I think the placement year is really, really good, and it's really beneficial to make you more employable. Studying in Ulster, I thought, I was attracted to Ulster always. I had cousins that went to Ulster. From going the transition from school to university, sort of always scared me a wee bit. I didn't really, not that I didn't like school, but I wouldn't have been one of the top achievers. And the transition between school and university, I was always weary of that. But university is just so different in a good way. Everybody is friendly with the lecturers. The lecturers are always encouraging you and wanting the best from you. They're almost, it's not like in school where it's a teacher and a student. It's everybody wants the best for you, and they're willing to help one-on-one and in groups as well. I just find, the transition, nobody ever tells you how to transition into university, and it is very daunting. Like in school, you're used to putting up your hand to ask to go to the bathroom, and in university, you're treated like an adult. You don't have to put up your hand to ask. That was something that is never really told to anybody, but I find the transition very easy, and at Ulster, with all the facilities and all the help, they make the transition very easy too, because it is daunting going from a high school or a tech or a secondary school going into a university where there's thousands and thousands of students and lecturers, and it being such a big campus. As I was saying, we're based in Jordanstown, so everything's under one roof in Jordanstown. The facilities are great. You have your computer suites, the libraries. Within environmental health, we have sessions and lectures in the labs. So there was the microbiology labs, the noise labs. Everything's all under one roof, and you have access to all of that included in the environmental health course and at Ulster. So I just find everything was just so straightforward, and I transitioned really well from secondary school into environmental health. And I definitely do think if you are hands-on, looking at a challenging job, problem solving, as Marie said, those are the characteristics definitely needed for doing environmental health. And that's really all I have to say. I don't know if anybody has any questions that I would be able to answer.